Hey, and thank you for joining us today. I am here with John Mckeon, and we are talking today about allergies. I know what you're thinking. You're thinking, oh no, my eyes itch and my nose is all clogged up. And I know exactly how you feel. I've felt that way as long as I've been cleaning houses, which is going on 3 decades now. When I joined the cleaning industry, I had no idea that allergies were such a thing. And I live in North Carolina, so we have lots of bee pollen. There are flowering trees that make my eyes water and itch. And then I would go inside people's homes, and then there was dust and pet dander and all kinds of indoor air quality things that triggered allergies for me. And that doesn't even start to talk about the cleaning chemicals that I was using. So it's been an ever going process for me to try to find the cleanest way to breathe while I've been cleaning. So here we are today with an expert who is going to share with us some ideas and kind of unpack the different issues that we've been dealing with. I want to invite you to jump in and ask your questions as we go today. And we are streaming to 3 audiences today. This is the Ask a House Cleaner show, where we have cleaning professionals and we have, I don't know, a lot of homeowners that are peeking over our shoulders as well. We're streaming to our Turnover Cleaning Tips audience, which are Airbnb owners who not only clean every other week, but sometimes multiple times a week, packing those chemicals on top of each other as they're trying to sanitize their places for the next guests. And we're also streaming today to our Hoarding World audience, which is our Clutter Corner show for homeowners who are trying to unclutter those areas of your home that have dust and, stuff packed in that we haven't really kind of gone through for a while. So I want to lend everybody's ear to today's conversation, because with us on this call today, we have John Mckeon, who is the principal at the Eye Air Institute, and he's a medical entrepreneur. And along with that, he's currently the CEO of Allergy Standards Limited, which is a company that he created while he was an emergency room doctor. So he's got all the background and all the experience and all the expertise to help us learn a better way to live. So please help me welcome John to our show today. How are you today, John?
I'm great, Angela, and thank you for that very kind invitation. I just want to say it's a great opportunity to speak to your audience, your listeners, because as a medical professional, it's a really great opportunity, not just to speak to people as patients, but speak to people who cleaning professionals, who look after our indoor environment, and that whole aspect of indoor air quality is so important, and how we clean and maintain our homes. So I'm delighted to have the opportunity to speak to you and your listeners.
I'm curious, why allergies? How did you end up here?
Yeah, I mean, you mentioned there in your opening about outdoor air quality and pollen, and obviously May is Asthma and Allergy Month, and we work with our partners, the Asthma and Allergy Foundation, who are a patient organization, and they've done a lot of work this month around asthma and allergies. And often people think about outdoor air quality, but when you think about it, we spend over 80% of our time indoors. And the US EPA is on many studies looking at indoor air pollution. It can often be 4 to 5 times more polluted than outdoor air. We hear a lot about climate change and adverse weather events, forest fire seasons coming up, longer pollen seasons. But really, if you're going to get serious about asthma and allergy, you need to tackle indoor air quality. And I got really curious about the connection between the built environment, our indoor environment, and kids with asthma and allergies, because as an emergency room doctor, parents would come to me and they say, look, doctor, is there something we can do to stay well? And being healthy these days isn't just the absence of sickness, it's actually being well in so many ways. And when you're talking about asthma and allergy, you're talking about the triggers, the trigger factors, the things that trigger your allergies. And you need to tackle the indoor environment. As I said, we spend 80% of our time in there. And I would give the parents advice about what pillows to use, what vacuum cleaners, should you use air cleaners, bedding, and then it would come to cleaning products. And I could give advice about dust mite allergens and VOCs and formaldehyde, and we're going to go a bit deeper on those throughout the call today. And people would write down this information, but the way we describe it is that we're today, particularly with Google and Dr. Google and ChatGPT, we're drowning in information, but we're starving for wisdom. And what we want is actionable insights. So people would write down the information, but then they'd actually go out and look for labels and what product, and they very quickly get confused. And if you're talking about the indoor environment, it's very much a whole of house approach. or your school. So it's not just one aspect. You've got to look at, as I said, the paints, the floor coverings, how we're cleaning. So one of the mums actually came back to me and said, look, doctor, I know what you're saying, but it's so hard to cut through the noise in the marketplace. Wouldn't it be great if somebody could test these products, and then if they don't contain certain triggers, they have certain performance criteria, they're helpful to improve your indoor environment and avoid the trigger factors, we could label them. So as a doctor, that's the company I set up called Allergy Standards. We test and certify the products. And then we work with patient organizations. So in America, the National Patient Organization is the Asthma and Allergy Foundation of America. They're the trusted voice for patients. And they help us communicate the educational message of the certification program. And I see you popped up on the screen there. Very much encourage your listeners to go to AFA.org/certified. And there's tons of information. There's doctor and nurse written content with tips and tricks. So that's how I got started in this whole area about the connection between the indoor environment and health and wellness outcomes.
So is it as simple as just going to the website and then picking those products and bringing those into our home, and then we're healed?
No, it's not. I wish it was. I mean, one of our moonshot statements, and as an ER doctor, I can say this, is we want to eliminate all emergency room visits for an asthma attack that was caused by exposure to an avoidable trigger. We don't want people turning up to emergency rooms because their symptoms were triggered by something they could have avoided. And our job is to educate people. So it's not just picking all the products. It's coaching, it's patient empowerment, getting educated, understanding what you're allergic to, where is it showing up in your indoor environment, how can you remove that, things like mold, and we'll talk about buildup of bioburden in buildings, chemicals, you mentioned about chemical sensitivities and the overlap between chemical sensitivities to allergic responses, and how sometimes chemicals like formaldehyde can kind of have an additive effect, an accumulative effect on an immunological or immune response, like an allergy reaction to dust mites, and they're very much, the chemistry and the biology are connected. So part of it is choosing products, but then there's a whole lot around how you design a healthy indoor environment.
Let's talk about the healthy indoor environment, because many people will come to me and they say things like, "Oh, it doesn't smell clean."
Mm-hmm.
And
Yeah,
I say, clean does not have a smell. We don't need fragrances that
yeah,
agitate allergies just to make it clean. Can you
yeah.
talk to us about some of the things that we might be doing wrong and ways that we can overcome that when it comes to preventing those triggers?
Yeah, absolutely. Well, so first of all, having conversations like this is fantastic, because joining the dots on how our indoor environment comes around. So you think of architects, the people who design the buildings, the construction professionals who build them, the materials, interior design, people who do the interior design, the fabrics, the floor coverings, the wall coverings, then people who ventilate it, and you have all the ASHRAE standards. But then you've got to look at the facilities management and the janitorial stuff, the people who clean it. Because there's no point building a planet-friendly, environmentally green or eco-sustainable building if you then clean it badly and you have a buildup of VOCs or buildup of bioburden. So first of all, having conversations like we are today and bringing lots of stakeholders in. We know that in the US, you're spending nearly 20% of your GDP on healthcare. And that's kind of access to doctors and medication. And what people have realized is that we really need to spend more money upstream on the determinants of health and avoiding people getting sick. And the indoor environment is very much part of that. So I'm not trying to change all your listeners and viewers into emergency room doctors, but I would like them to consider that as part of cleaning professionals and cleaning for health. Not just cleaning for appearance anymore. We're now cleaning for health, particularly after the pandemic. People have joined the dots in their own mind about how my indoor environment and cleaning is actually related to my health outcomes. It's not just a cosmetic and appearance thing. So first of all, having the conversation is really important. The other thing I would say is that expression, cleaning for health, not cleaning for appearance. And if we are just going in and we're putting heavily fragranced products into the environment. We're putting in masking fragrances. Well, first question I'd ask is, well, what are you masking? What's the source of it? So is there actual mold in that business, in the building? Is there
Mhm.
something, there's a source of poor health that may be causing irritation and mold and streaming, and we're then adding lots of chemicals and fragrance and masking on top of that, and then you're getting a combined effect. So the first thing I would say is that if you need to use heavy fragrances, why are you doing that? Is there something else you could look at beyond? And then I would say that the point you made there is that we don't necessarily need to clean with harsh chemicals. We want to clean for health. It was quite interesting during before the pandemic, people had kind of moved to more, let's call it healthier, less harsh cleaning products. But during the pandemic, people all went back to the old faithfuls. They go, no, I want bleach and I want really powerful cleaning products. And you know, now I'm really cleaning for viruses and things like that. And I think it'll probably, the pendulum will swing back. People want to use chemicals that are good for the environment, they're planet friendly, but they're also people friendly. They have to be effective. I mean, people won't use products if they're not good enough and they're not fit for purpose. So it's really the challenge for the industry to develop effective products that can be lightly fragranced so that they're more people friendly, and they don't have the extra harsh chemicals. I think that's the real challenge for the industry in the future.
Well, you asked a really good question when you said, if we're trying to mask something, what is it that we're masking? What
Mhm.
kinds of questions should we be asking ourselves to uncover some of the maybe the culprits that are causing those triggers in our allergies and our asthma?
Yeah, well, and I want to be respectful of the fact that sometimes people, they may have a tenant and it may be out of their control to do some of these things, but you can get help. There are housing authorities if you're, say, in an area where you think you may have mold in a bathroom or extractor fan isn't working, so you're getting steam building up and you're having to clean and put in bleach and harsh chemicals. So, you know, again, I mentioned about the afa.org there as regards to getting help and looking at local health groups if you need help in your home in that way. But where you can control, moisture is a big issue. I mentioned about bathrooms, in basements, you can get buildups. There are, in fact, afa.org that you have on the website, they have a healthy home checklist that you can download. It's a PDF. You can go onto their website and they'll coach you, do it's a virtual walk around of a home. So sometimes people can have VOCs or paint or harmful fumes are coming from the garage because that's next to the kitchen. In crawl spaces, in lofts and attics, you can get moisture buildup, obviously bathrooms. So there is a way that you can visually walk around your home and there's known areas that you can get buildup of molds and allergens, and start there with good cleaning rather than, as I said, covering up with sprays and fragrances.
So, would you recommend basic behaviors like always turning on a ventilation fan in a bathroom when you're in there taking a shower or something like that?
Yeah, I think the expression "the whole of house approach." There isn't just one size fits all. If you're looking at redesigning or ventilating a house, you've got to look at low VOC paint, low emission furniture. If you've got textiles in your bedroom, you're looking at ones that themselves don't contain harsh dyes and chemicals in the textiles, that they're good dust mite barriers. So there's a whole way you can convene your indoor environment for it to be better. And then a lot of technology. I know in the questions you sent me in advance, you talked about new technologies. There are some really interesting technologies. The smart home of the future, the smart building. And I only realized, I thought smart meant clever or connected. It actually means sensing, monitoring, and real-time feedback. So one number of companies now are developing smart sensors in bathrooms. So when the humidity level goes on, the extractor fan kicks in until you balance back to the right humidity. So I think there will be sensor technology in the future. You'll be able to measure VOCs, particulates, other harmful chemicals like formaldehyde in the air. So I think going forward, there will be some technology solutions, particularly around balancing humidity.
When you talk about VOCs, what is important for us to know about VOCs when it comes to triggering allergies and asthma?
Yeah, well, that they can is first of all, and there's ones that are particularly formaldehyde. One that has been used in paints. It's used as a curing agent in furniture. It's used as preservatives. So it is something that traditionally has been in a lot of household products or under the sink products. And there's other harsh chemicals in there. So I think just be aware about it. Just do some Googling, educate yourself. So you can go to AFRA as well. And we've done a lot of research. The IAIR Institute that I'm involved in is very much a research organization that does white papers, technical papers. We track legislation from government. If the US Green Building Council, for example, has lowered an emission level of VOC. So there's a lot of technical information there on it. And I suppose it's just to be aware that these products, these VOCs, are in cleaning products. So when you're cleaning, if you're particularly sensitive, you can wear face covering or a mask to avoid inhalation. Make sure the room where you're cleaning is well ventilated with good air exchange. And if you have cleaned a room, make sure it's ventilated until you go back into that room if you're somebody who's sensitive to VOCs.
And I love that you brought that up. One of the things that is really important to me personally is that a cleaning business owner read the
Mhm.
safety data sheets of the products that they're using and then train their employees on the safety precautions for that. So that if there is something with a harsh chemical, because sometimes we need harsh chemicals for a heavy duty job, but that
Yeah.
we're wearing the personal protective equipment that
Mhm.
is required for that particular cleaning chemical so that we do have the proper protection so that we're not inhaling fumes or things that make our eyes cry and make
Yeah.
us feel weak and sick for days after we clean a project.
Yeah, yeah, absolutely. And certainly the US Green Building Council, the lead V4 standard, was the first of the standard of kind of a green building to look at cleaning and facilities management as part of your lead credits. And I know lead V5 now is open for discussion. And if some of your listeners want to go and comment on that standard in the US Green Building Council, they're actually open for public comment now. And I know cleaning and the facilities management industry have a lot to say about that. If you're going to have a US Green Building Council building, certainly the highest level, they're seeking the fact that we are looking at how are we cleaning that building and the people who clean there. We were speaking earlier about if you think of a school setting, you've got the kids who are sitting in that environment who are learning, and particularly K through 12 schools. You've got the teachers, that's their place of work, so it's an occupational exposure for them. But then you also have the cleaning professionals who clean the schools, and it's an occupational exposure for them. So everybody really should be vested, whether it's the kids in the classroom, the teachers in the classroom, or the cleaning professionals, to make sure that the SOPs or the protocols for cleaning that school, we are looking at labels and we're specifying low irritancy, low VOC, and as lower risk as possible products.
I remember when I started in the cleaning industry, this is many decades ago, but there were families that started ripping out carpets and drapes and things like that because of the allergies that were trapped inside them that would, and I say that trapped inside them, triggers, I guess, that
Mhm.
would then make their eyes cry and they couldn't breathe and they were going to the emergency rooms and they were getting shots on a regular basis and they were always constantly taking antihistamines and things like that to try to fight the allergens in the home. And I thought it was just me as a cleaner, but a lot of the customers that we had were
Mhm.
also fighting the allergens on a daily basis. What are
Mhm.
some common things that are in homes that we find that are causing and triggering those allergies?
Yeah, so you can break it down into kind of three buckets. We break it down as first of all is gases and VOCs, and we spoke a little bit about the kind of the chemical things in the air. Then you have biological particles, and we can put allergens into that. And then also within the indoor environment, you have other microbiology, so viruses and bacteria, and mold as well. When you're getting into viruses and bacteria, you're talking more about infection and becoming sick. Like coronavirus was obviously an airborne virus, but there's other bacteria that can be around there. And we need to be careful about, are we talking about becoming sick with an infection where bacteria or a virus become infected, or is it an allergen, which obviously is a pathogen, it can cause illness. That's what pathos is Greek for illness, and gen means it generates, a pathogen. But one's through bacteria and infection, one's through an allergen is causing an immune response, a hypersensitive immune response. And then you have the various particulates. You'll see PM2, fine particles as well, which may not be particularly allergens, but they're fine dust particulates that get in the air. But they also can cause airway irritation and so forth. So they're the kind of the three buckets that we look at them: chemical, microbiology or aerobiology, and then particulates and gases as well would be in the VOC buckets. And in the indoor environment, allergens, you're talking about, well, obviously in bedrooms, you're going to talk about dust mite allergen. There's DER-P1, and there's different types of allergens. We have a slightly different strain of dust mite in Europe than you have over in America, and sometimes in the built environment can be slightly different as well. Some other allergens in the built environment will be cockroach, particularly in urban areas. That's something that can cause allergic symptoms. And then you can have other pests like mice and things like that that can cause allergen. You can bring outdoor allergens indoor. We can bring pollens. It's obviously it's pollen season at the moment. I mentioned at the beginning that there's longer pollen and allergy seasons now due to climate change. There's more moisture in the air. There's actual research now to show the actual allergenicity, the power of the pollens themselves per gram, as it were. They're now more allergenic than they used to be. They used to be more benign before climate change. And there's also this good evidence that pollens associated with particulates and other fine dust combined together can cause more allergic symptoms. So we can bring allergens from outdoors inside on our clothes, on our shoes, and things like that. And then, as I mentioned, indoor environment, mold is one, the big one. They call it the silent epidemic. People with chronic coughs and chronic streaming in the indoor environment, often it can be exposure to mold that they don't realize is in the building.
Mm-hmm. Well, and I'm glad you brought that up because we literally, in the cleaning industry, we literally send out notices to our customers that says it's pollen nose closed because they open the windows for fresh air. And then
Yeah.
we find literally we can see visible pollen all over their
Mhm.
keyboards and their computers and their game, in the remote controls. And not only is it hard to clean, but then
Yeah.
we're also breathing that, and that gets stuck in the carpets and on the draperies and all the, and
Yeah.
they're out for some fresh air. But then
Yeah.
we run the risk of having a sealed off environment
Yeah.
where the stuff is trapped in the environment.
Mhm.
Now we need HEPA filtration. Can you
Yeah.
talk to us for a little bit about some of the air filters and the need for air purification systems?
Yeah. Well, first of all, what you're saying there just shows what a complex issue this is, and how the doctors won't figure it out on their own. The architects, it needs everybody to come together. Because if you say,
Mhm.
well, look, we want to open our windows, we want fresh air, we want to circulate the air. We all know that recirculated air is unhealthy, but then what's coming in from outside as well. So it's not just one solution. It's cleaning, it's ventilation, it's all those things. In one easy, not easy, but one low cost is pollen screens. And that's something I think people will see more and more, because they want to ventilate their buildings. They don't want to rely on expensive air ventilation systems. They may not be able to afford an expensive air ventilation system, or may not be able to afford to run them, because it's
Mhm.
actually quite expensive to run air through media-based filters all the time. So I think pollen screens and bringing fresh air in, but not bringing the allergens in, is something that people should consider a bit more. And then what you're talking about there, cleaning and reducing the reservoir or the build-up, whether it's your keyboard I have on here, and cleaning professionals coming in and reducing the reservoirs, the natural build-up, is really important. And I would actually put that more important above air cleaners. And ventilation and source removal, i.e. cleaning, are the two best things you can do. And then you can look at filtration. But once the allergens get in and they build up, you're really fighting a losing battle then if you think, well, then I'm just going to use an air filter to
Mhm.
actually remove it. But air filters do play a role. But as I said, I would do avoiding buildup first, removing buildup of reservoirs second, and then look at air filters. And I think what you'll also see, or we are seeing already in the US, is they'll probably move to a more European style model, where we have kind of zonal heating of our buildings. We have split air conditioners or portable air filters rather than the traditional central furnace filter in the US, which a lot of homes have at the moment. We work with a lot of those companies. We work with Train Tranquility. They have a product that we validated. We brought it over to the laboratory here. We've looked at the air filtration capability, the pollen trapping, denaturing of allergens, and we've validated it to our performance standard. We also work with 3M Filtrete, and they have furnace filters, and they have particular pollen trapping ones and other standards, and we validated those technologies. So filtration does play a part. We work with Rabbit Air, we work with LG, we've worked with Dyson in the past, looking at portable air filtration devices, because somebody can have a playroom, so they may have turned off the heating and cooling in another part of the room, but the kids are in a particular bedroom, and so a portable air cleaner is good. In that kind of zonal, just heating one room or just cooling or just ventilating one room. So I think we'll see a lot more of that in the US going forward. But I would definitely re-emphasize the point about cleaning and removing buildup of reservoirs of allergen is a better thing to do than over rely on air filters, because that's kind of after the fact, after it's got into the air.
And what makes a cleaning product hypoallergenic or allergy friendly?
Well, hypoallergenic, again, I'd encourage your viewers to Google the word hypoallergenic, and you'll actually see on the Federal Trade Commission website, the FTC and the EPA, that it actually doesn't mean anything. It was coined by the cosmetic industry in the 1950s. It has no scientific basis. It's kind of got its way into our normal, use of English, but there's actually no technical standard that something to be hypoallergenic actually is. That's why there's been a requirement for verification performance standards. So and there are a number of good organizations that we work with. The Home Appliance Manufacturers Association, AHAM, have their CADR rating, their clean air delivery rate. Doug and his team at Green Seal, they have a good eco mark, and there's a number of good certification programs that we're very happy to work with. Our asthma and allergy friendly certification standard means that we validated the cleaning product to be below thresholds. We specify very strict limit levels, both what's in it, but more importantly, what outgasses, because we're not talking about necessarily dermal exposure and skin contact, because people should wear PPE if they're cleaning, but we're talking about what in medicine we call about the exposure pathway. And the exposure pathway for something, when you talk about asthma, is inhalation. So it's really important that what there may be validation of the cleaning product, but what we're really interested in is what gets into the breathing zone, what people breathe in. So they're the first things we look at: bulk analysis or constituent review, then very particularly an emission or a VOC outgassing review, and then it's got to be fit for purpose. It's got to be an effective cleaning product that's been proven under laboratory conditions to remove allergens and without redistributing them back into the air. So it's a kind of a chemical, a constituent review, an outgassing review, and then an allergen removal performance review as well.
Wow, that's really in depth. So if you're just getting started on an allergy removal or an allergy management routine inside your home, where is
Yeah.
a good place to start? And I'm just talking about an average homeowner that is just getting started. They're like, I have allergies, I don't feel
Yeah.
well, I'm constantly sick. Where would they start in their home?
The bedroom, always the bedroom. I mean, it's where you spend most of your time. If you're lucky enough to get 8 hours of sleep a night, when you think about it, you're in your home, you're probably in the bedroom or your kitchen most of the time, and then if you're relaxing in your study or your TV room or whatever, but mainly the bedroom. And the bedroom in the home setting is a classic buildup of allergens, particularly in the bed linen, the pillows, the mattresses. So good allergen barriers, dust mite allergen barriers. If you have linens, they can be washed at certain temperatures to remove allergens. There will always be a natural buildup of allergen, so we can bring it in our clothes and so forth. And then people may have floor coverings, whether they're area rugs, buildup of dust mite allergen and other triggers in floor coverings as well is very important. You vacuum and clean and remove allergens. And then the other area to look at would be the bathroom. Again, moisture build-up, particularly mold build-up. And then the last, say in the order, so I would say bedroom first, bathroom, and then your kitchen. And the kitchen area is under a lot of scrutiny at the moment. We, particularly during COVID, the way we use our homes has changed. There are studies, there are schools, there are cinemas, there are restaurants. So we're generally spending more time there. So within the kitchen, there's been a lot of research now and a lot of controversy about gas stoves and particulate matter and fume hoods and ventilation and use of candles and use of cleaning products. So that's another area of the home that I think people should pay attention to, the kitchen and cooking.
So if we were to go a little bit more granular than that, if we start in the bedroom and you
Mhm.
mentioned area rugs, how often should we be vacuuming those area rugs and or carpets?
Well, if you've got fitted carpets, there are certain. We work with a floor covering company called Target, and we recently certified. They've developed a new hybrid floor covering. It kind of has the acoustics and the comfort physiology of a carpet type floor covering, but it has the resilience and the allergen removal capability of a resilient floor, like a hardwood floor. But the truth is, people don't like to have a lot of hardwood floor in their bedrooms, that therefore they like to have an area rug. I would say you should reduce if possible if you're using carpeting, particularly plush pile or deep pile carpeting, and try to have areas that you can clean within your bedroom. Um, if you've got fitted carpets, again, you can just Google the US EPA, and they say that you should really be steam cleaning our carpets. We did a lot of research with a steam cleaning carpet company called Stanley Steamer, and we validated their hot water extraction methods. And the US EPA says everybody should be steam cleaning carpets, particularly if you have kids with asthma and allergies, twice a year.
Oh,
Um,
wow.
and then you need to be vacuuming, regular vacuuming, at least once a week. And again, that's the whole concept of just decreasing the reservoir. So you're going to get a little buildup, and then you want to be keeping that down and that down. And there is recent research that well-maintained carpets, ones that are obviously low emission, we're not talking about VOCs and formaldehyde, which has been a problem, a challenge for the carpet industry in the past. Don't think it is anymore, because they're so committed to sustainability. All the reputable carpet companies now are very committed to sustainability and VOC and a planet-friendly approach. So VOC and outgassing from carpets isn't the challenge it used to be. And also, if carpets are well maintained and they don't get water damaged or moldy, or don't allow allergens to build up, there's some good evidence to show well maintained, good quality carpets can actually be an okay choice with people with asthma and allergies.
Excellent. Thank you for that. So we will be vacuuming our carpets and our rugs once a week.
Yeah.
How about the linens? You mentioned washing the linens regularly. How often do we need to do that?
Yeah, I think again, weekly is where you need to be. First of all, your choice of linens. There are a lot of harsh chemicals that are used in the spinning and the finishing of textiles. Certainly, there's allergenic dyes, there's certain colorants that goes into fabrics, things to improve textile performance, easy iron, optical brightness. So there are things that people should look at to make sure that they're not in the textile linens, and particularly you're sleeping next to them, you get dermal transfer when you're lying them up against your skin. Obviously, you sweat a lot at night and so forth. So there are some good certifications on textiles. We will accept crosswalks into our standards from people like the Global Organic Textile Standards. Ecotex is another textile standard. The Nordic Swan is one in Europe. So first of all, the linens that you're buying, make sure they themselves are free from harsh chemicals. Then you should really be looking for allergen barrier. So what we might call dust mite allergen proof or dust mite proof zipper covers for pillow casings and encasings for your mattress. And then your linen should be washed at least once a week. And some people should consider washing, particularly if they've got a lot of symptoms and they really think it's an exposure to allergens in their bed linen, doing a hot wash. So a temperature above 55 degrees, so enough to denature, remove those allergens. And that's something that's going to be debate about in the future, because should we be cold washing our bedding for energy efficiency? But I'd certainly think that if somebody's got allergies and they feel it's coming from their bedding, they should be doing a hot wash, a hot temperature cycle wash on a regular basis to remove any surface allergen or potential allergen buildup inside the products as well.
Excellent. Any comments on the type of laundry detergent to use?
One, again, I wouldn't use biological or enzymatic ones. Often you have enzymes in some laundry detergents. Those enzymes are to eat away at the stains. That's what they're there for. With those enzymes, there are research to show that they can stay within the fabric, and those enzymes can then cause skin irritation. And so what in Europe might call biological or enzymatic driven laundry detergents. There has been some research that fabric softeners sometimes can stay residual, and the way the chemical action they have on the fabric to unfold and become soft can itself have an impact on people's skin. So again, I would do some research in that area. And we have worked with some clients in the past. We work with a company called Renegade Brands, and they have a Sweat X product, which is originally designed for sportswear. And it was so popular with the athletes, they now have a consumer-facing product, which is free and clear. So Sweat X free and clear. And we've worked with Renegade team there, and they've specifically formulated this laundry detergent for people with skin sensitivity.
Thank you for that. I want to stop for just a second and say hi to all of our friends. Thank you guys for joining us. Mel Brooks says this is a terrible year for allergies in California. Rachel Rose says, yay, I caught a live love from England. Hi, Rachel. Good to see you. We have Rachel Tarr that says, hi there. Black says, this is gold. We have Jay Durham that just gave us lots of sniffles and little allergy emojis. And yes, I know exactly what you're talking about. Jay Durham says cleaning for health. Janine says, hi, Miss Angela. And Rachel Rose asks a question. She says, I live in a very rural area where tractors churn up the red soil, which makes its way into my home and it settles. How harmful are the fine particles of soil? Thank you. That's a great question.
Well, hello to the person from England. Well, I'm in Ireland here, so we're just across the water from you. Yeah, again, I don't know exactly the case there, but it is having dust or outside particulate matter coming into home, whether it's diesel particulate if you live near a freeway or in a rural area. What's interesting about that is that we often associate with poor indoor air quality and poor outdoor air quality with cities and traffic and congestion and pollution, but there's somebody who lives in a rural area who has a challenge with indoor and outdoor air quality. Yeah, nuisance dust and things like that are a real problem. I don't know, can she stop it being exposed to it? But obviously, if it is getting in, cleaning and removal. I'm not sure what the particle sizes are and what a pollen screen or something like that, but she could look at, particularly pollen screens will go down to around 2 microns, which should maybe avoid some of the fine dust coming in. But certainly where it builds up, she needs to be diligent about removing it. Yeah, it's not an allergen, but it will be uncomfortable and will cause irritation, and long term it can cause health issues, definitely.
Thank you for that. Joanne says, Joanne from Virginia here, cleaning or replacing that vacuum filter has been a real changer in our home. What a difference. It smells so much better. And I want to thank you for bringing that up, because yes, we do have the power to keep our air filters changed, especially in a vacuum. If we're vacuuming every week, that's important to double check that. So I'm glad that you brought that up.
Yeah.
Then we have another question. Kim Bajaz says, thanks for the great information. What about animals who have allergies, like a cat with asthma? Which cleaners are okay to use? That's a great question as well.
Yeah, it is. It is. I'm not a vet, unfortunately, but it is an issue. Animals get allergies as well. And and therefore we're not just cleaning for ourselves, we're cleaning for the home, and the home will have pets. So it is important just to look at that. I mean, some cats get allergies to cat litter and things like that, so there are these new formulations of cat litters and things like that. So yeah, I'm not exactly sure about what cleaning products for cats, but it is a good point that a home is not just for everybody. Sorry, it's not just for the people. There's also maybe family pets as well, and you've got to keep it healthy for them also.
Is it just a matter of trial and error when you try a product just to kind of watch and see if the kids in your family are itchy or if your animals are sneezing or if your eyes water after you use something and try to narrow it down and say, okay, that one didn't work very well for us, and then just eliminate that on a trial and error basis?
Yeah, you bring up a very good point. I mean, there are kind of red flags that are in products that are going to cause irritation and trigger allergies for everybody. So clearly, reading the label, there's certainly preservatives that are well known. In the EU, we have a list of 12 allergens and triggers that can't be in cleaning products now, and so you can check regulations. Sodium lauryl sulfate causes a lot of issues with people. Sodium, the various preservatives, ammonia and sodium hypochlorite and things like that can just cause irritants. Some people can be very sensitive to those. So you can read the labels and look at the flags for you. But another thing that's often overlooked is that you can get patch tested and skin prick tested and get really educate yourself around, well, what are your trigger factors? Because not one size fits all. And you need to know, well, what are you particularly? You can do patches, leather patches, patch testing. And then we've developed an app ourselves. And again, if you want to email us in on the website there, we're redeveloping at the moment because we're just updating the database. But essentially, the app, you could feed in your own data, what you're particularly sensitive and what you know you're sensitive to, and then you can scan the QR code or the barcode of a particular product, and you can say, this has got a chemical that you're particularly sensitive to. Or you could take something that you know, that one always really irritates my eyes, or that one, whatever is in there, something in that just triggers me. You can scan that, enter that into the app, and then when you're buying another product, you can cross-reference or triangulate, are some of the chemicals in that, and is it likely to cause an issue with me? So there are some new technological solutions. There's also EWG, or Skin Deep, very good organization. We work with them that have a full database that rate products, and you can look at the disclosure of chemicals that are in there. The trouble is that in the US, the disclosure guidelines or regulations aren't as strict as they can be in Europe. So you don't need to actually declare, once it's below a certain level, what's in there. But the point you make is a very good one, that everybody needs to engage, document, put things in their iPhone, and get really up to speed on what works for them, and then take control and be empowered and educated so they really know how they can configure their environment that works for them.
Well, and that's really interesting because when we go inside people's homes as professionals to clean, the homeowner is exposed to our cleaning chemicals for a short period of time, and then we leave, and then they don't clean their home with those same chemicals for a couple of weeks until we come back again. But the
Mhm.
cleaners themselves are exposed to those chemicals all day, every day, going
Yeah,
inside all the different homes. And so
yeah.
it's been an ongoing process of us really trying to hone the chemicals that we use so that they have the maximum amount of power for cleaning and that
Mhm.
they have the least amount of allergy triggers for our heads and our hearts and our
Yeah.
respiratory systems.
Mhm, mhm. Yeah, no, absolutely. But and again, I say that's why I was delighted to come on this episode, because I think the role of just to call it Jan San or cleaning or whatever, certainly in the office or the commercial setting, it's been almost elevated to a HR issue. Because somebody's going to go back, I was working from home, I'm now going to go back and work in wherever it is, Google or Facebook or one of the big blue chip Americans that we have. They're all based here in Dublin. People are going to need to be convinced, well, am I going back to a healthy environment? And with office buildings now, they're either grade A office buildings, like best in class, or I work
Mhm.
from home. there isn't going to be any middle of the ground offices. So people are going to make the commute, the effort to commute and physically go into work. They're going to ask, well, can I cycle to work? Is there a shower at work? Is there good food at work? Is there a meditation room? All those things about what people, the quality they'll look for working. And part of that will be, well, how healthy and well maintained and how clean is my office building? So I really think your industry and your people, your colleagues, your co-workers really will have a role, a much important role to play in healthy buildings. And we're not going back. The genie can't be put in the bottle. Everybody now is switched on about indoor air quality. Just because you can't see it, we talk about the expression making the invisible visible. People now really get cleaning, and I said it earlier, cleaning for health, air quality, whether it's my home and my home office, like where I am now. People are really now looking around and making sure that it's a healthy indoor environment.
Well, and I know a lot of homeowners are as well, and I love
Mm,
the fact that you brought working from home up because
mm,
that's a real issue now where lots of people are still working from home. And I
yeah.
know that there are cleaners that come to me on a
Mm,
regular basis and they say, "Hey, I'm in a bind. I go to this customer's house, and every time I clean this particular customer's house, when I leave, I'm sick for 24 hours after I get
mm,
home."
mm,
And there are some homes that, like you mentioned, they have irritants like mold and things like that that are in the house that maybe you can't see them,
mhm,
and they're in the walls or something like that, that
mm,
when the house cleaner leaves, they are physically ill for
mhm,
24 hours after they're in the customer's home. So
yeah.
what are some of those things that we can be on the lookout for that if it's our home and we're sick inside our home, but we don't really know what it might be,
Mm,
how
mhm.
do we recognize some of those irritants in our homes?
Yeah, it's great. It's a great question, particularly your staff that are going in. Potentially, they could be allergic to cats or something, and that home has a lot of cat allergen in it. The cat maybe isn't there. They take the cat out when you guys go in to clean, but maybe there's lots of allergen in the air, and the person allergic to it. So, I mean, that's interesting. What you will see going forward, I mentioned about smart home connected technology. You know, people are familiar with brands like Nest and so forth, but a lot of the portable air cleaners now have particle counters on them. Some of the new air cleaners will actually start at VOCs or particulates go a certain level, they kick on automatically. And you can have the very inexpensive desktop air quality monitors. So I think that is going to play a role going forward, that part of a home will have an indoor air quality monitor. And it would be very interesting to the homes where you're saying your staff are going into, or your colleagues are going into, if they had an air quality monitor, a handheld one, they went in there before they started, what would it pick up? Or if you took air sampling, which you can now, you can put in air samplers running for an hour while you're doing the cleaning. You can bring that away to the laboratory, and you can. There's a company in the States called Indoor Biotechnologies. You can send samples away to them, and they'll give you. I think they do 20 common allergens of one dust sample or air sample. They can look at 20 common household allergens. So there is a lot of technological advances that you'll see monitoring, sensing, new technologies about what is in the air, and we won't be flying blind anymore just because you can't see it. There will be technologies that can look at it. So I think that's something that you're going to see a lot going forward, and maybe it's something that maybe your colleagues and co-workers will actually bring sensors while they're cleaning, because it's interesting to look at when they clean. Do VOCs go up in that building? Do particulates go up? When do particulates come down? When is it a good time to go back in after you've cleaned a room and ventilated it and aired it? When's a good time to go back in? So I think some really exciting technology solutions to find out some of those answers you're asking in the future.
I love the fact that you're on the cutting edge of all of this and that you have a certification program that goes through and it looks at different products from
Mm.
flooring to vacuums and dusters and cleaning chemicals and things like that. Tell us a little bit about the certification programs and what it takes for a company to become certified through your program.
Yeah, well, depending on what the particular category is that you've mentioned, all if you think of a house, and we kind of think about if you took a house and turned it upside down, what would fall out of the house, as it were. So it's all the bed linens I've spoken about. We look at chemical, we look at the allergen barrier effectiveness, but with bedding, it's also got to be comfortable. So we look at comfort, physiology, airflow, moisture transfer, wickability, can it be washed at high temperatures? So it's very much a comprehensive assessment of the product. And if it's a cleaning product, I mentioned about chemistry, I mentioned about allergen removal. Is it effective? Is it a good product? In the past, a lot of allergy bedding, for example, was very noisy and uncomfortable. It was very sweaty, so people just stopped using it. And they said, "Well, like, I'm supposed to use this barrier, but put it around the pillow. It's sweaty and noisy, so I'll just take it off," kind of thing. So we've made sure that our certification standards make sure the product is a good quality product. It's not you're not settling for something because you've got allergies. I have to settle over here with an inferior product. It has to be top class. And you look at all the products on our website that are certified are all excellently performing. We'll then look at their ability to remove allergens, their impact on allergens. We'll look that they don't cause any harm themselves. And then we look at the other aspects of it. So if it's a vacuum cleaner, we look at its ability to pick up allergens, to trap allergens, that when you're vacuuming, it doesn't actually throw up allergens in the air, or they're not getting trapped in the filter, or when you're emptying the vacuum. One of your colleagues there put in a question about changing filters. We will look at filter change of a vacuum cleaner. We'll look at bin emptying. We'll look at whether it's a traditional bag system or a dust cup system. When you empty it, you don't get whole clouds of dust and allergens coming back at you. So whatever the particular product is, it's very much kind of broken into two areas. First of all, is it safe, or does it do any harm? And then, is it effective? Is it good and fit for purpose? They're the kind of the two: safety testing and then efficacy testing across all the product ranges.
Well, and I love the fact that we are becoming more aware. And I think
Mm,
that's one of the keys. And I love the fact that you came on our show today to share with us the ways that we can prevent the stuff from happening instead of just trying to recover from it after it's already happened to us.
mm,
And I think
yeah.
that is kind of a wave of the future. Let us spend a little bit more money right now buying higher quality equipment, things inside our homes, better, like you said, flooring, bedding,
Mm,
linens, air filters, things like that, that will improve the quality of our health instead of waiting until we get sick and then we're trying to just manage the sickness. We're
mhm,
managing the wellness on the front
yeah.
end.
Yeah, absolutely. I mean, it wasn't my wording that said this. It was an ex-surgeon general, that in America, it's not so much as a healthcare system; it's a sickness reimbursement system. That it's you get reimbursed to pay people when you get sick, and nobody wants that. And everybody's realized now that it's not sustainable just to treat the downstream consequences of something that could have been avoided earlier on. And if you just move the dollars there to there, it's the right thing to do, and all society benefits. And we're seeing that now with I was at the Consumer Electronics Show early in the year in Vegas, the Consumer Technology Association, and they had a whole day on digital health. And they made the point that there used to be a question about, would consumer tech and health tech kind of merge and come together? And they say, look, that question's over. It will happen. We all have
Mhm.
wearables and smartwatches and smartphones, and consumer tech absolutely will merge with health tech. They've got some work to do on what platforms and confidentiality and billing and insurance companies, but it will happen. If you go to a doctor and he asks you, well, how much exercise did you? That's what we call declared data. How much exercise did you last week? Oh, I did this or did that. Or do you just give him your watch and he goes, well, I'll tell you how much exercise you did
Mhm.
because your watch
Mhm.
will tell me. That's use data. So that whole convergence and the nexus between consumer and what we do as consumers and what we do in healthcare, that is coming together. And I make the point in your industry and your co-workers, how we clean our homes, how we live in our homes, that is going to be part of the conversation going forward. And if we can spend some money in a healthier home, a clean home, hygienic home, better indoor air quality, avoiding unnecessary exposure to harsh chemicals, that is something that's going to be part of the conversation as we try and. It is a crisis. How do we solve this healthcare crisis? Everybody has a role to play.
Mhm. Well, and it becomes an issue when you start thinking that my liver and my lungs are going to be processing things that I put into the air. And so if I'm allowing things in my air that I know are not healthy for me, and I mean, we're talking about things like some people have removed smoking from their homes because they
Mhm.
know that that's not cool, that's not good for their lungs. But there are
Mhm.
a lot of other things that we let into our airflow that
Mm.
are also dangerous to our health. So as
Yeah.
we become conscientious of it is a prevention of illness and we're
Mm.
preventing it up front because we're taking better care of our bodies, we are then able to live longer. We're able to have a better quality of life while we're living. I think it becomes a question of not how do we recover from the sickness, like you said, but become very conscientious of what is our environment right now and what can we do, little tiny incremental steps to make it better as we go forward, not just for us, but for our children, for our pets, for our elder parents. It's the world around us.
Mm, absolutely. I mean, when you think of what you consume or ingest on a daily basis, there's a certain amount of food, there's a certain amount of water, but air, and it's about the size of a small swimming pool, about what we breathe in, what we consume on a daily basis. It's the air we breathe. It's the thing that if you take away, you take away your food and your water, you take away your air, it's the thing you die of the most quickly. So the idea of eating food off dirty plates, or having a dirty home, or drinking water, contaminated water, that we just don't do that. And now people with the pandemic have realized, well, air quality and how we maintain our indoor environments, surely that has an impact on our long-term health outcomes. And I think people are consistently asking that question, particularly for your co-workers, because as you said, that's what they do every day. They're being exposed every day, all day. So surely, if something's good for the planet and it's planet friendly, we want people to be using those cleaning products, whether it's architects or designers who are painting homes, so that the paints that we certify, or the installers for the floor and all those areas of the built or the interior design environment. Surely that makes as much sense to the people who clean homes, that they are cleaning homes and their exposure, not for the people who live in the homes, the people who are actually doing the cleaning as well.
Mhm. Well, and it's a cycle. We know
Yeah,
that when we read the safety data sheets and we become aware of even discarding products like an empty cleaning bottle, how
yeah,
is that discarded? Because there is an environmental effect as well. Can it go in a landfill? Is it harmful to the
yeah.
waterways? Is it harmful to aqua life? I mean, there's
Yeah,
a lot that's part of the big picture that when we
mm,
start becoming aware, we then have choices. And
yeah,
so I love this conversation today because it has brought to our awareness that we
yeah,
do have a choice,
yeah.
that we do have a
Just-
participation in the
yeah,
the world that we live in.
that's right. That's a really good word. The participation. We need to be engaged consumers, and give that feedback to people that we this is not good enough anymore for the brands, the retailers, our co-workers, that we're part of this. Just to bring up on that point about kind of product life cycle analysis, because I think it's a really good point you make, that the way we bucket it is your production ecology, how you make how you impact the environment when you make a product, and then you have disposal ecology, how you impact on the environment when you throw the product away. So when I make it, does it pollute the rivers? Is it recyclable? Does it go to landfill? But part of that conversation sometimes missed is the in-use phase of the product. When I'm using it, what does it do to my environment? Or if
Mhm.
I'm the cleaning professional, what does it do to me when I'm using it? So I think there's a lot of logo programs and eco programs around production. There's a lot of logo programs and eco programs around disposal ecology. But what I want to see more of is that in-use phase, the middle bit of it, when I'm using the product, who is making sure it's good for my environment as a cleaning professional or somebody who lives in a home. And I think that's the new area of the conversation.
Well, I love this conversation today. It has opened a whole bunch of ideas for us that not only can we pursue, but that we can start thinking about. We can open the conversation with our families, with
Mhm,
our cleaning providers, with the people that are helping us as we renovate our homes and as we
mhm,
upgrade the different surfaces in our homes. I know in the last 15, 20 years, we've seen lots of new surfaces from different types of vinyl floorings, different types of countertops. There's a lot of different stuff that's coming into our world that engages now a conversation on how is this the best way for us to live. So I really appreciate your time and energy today to make us more aware. I just love this. Tell
yeah.
our listeners where they can go to find you.
So below my name there, the IAIR Institute, so it's IAIR, stands for Indoor Air Innovation and Research Institute. Load of white papers. I gave a talk to Congress recently about K-12 cleaning of K-12s and airflow in K-12 schools, and we do a lot with the ISSA, the International Supplies and Sanitary Association, and they have the whole domestic or home cleaning groups. There's lots of kind of technical stuff on the IAIR Institute. For more patient literature, AFA.org, and it's the Asthma and Allergy Foundation of America.org, and then /certified, you'll find products and cleaning products. I mentioned like the Renegade brands, but they've got tons of, so the trusted voice of patients with asthma and allergy. And then allergy-standards.com is the other one, which is of scientific papers around how we test, the performance criteria. I mentioned about the constituents review, VOC, and allergen removal. So they're the three websites that people will get more than enough information. And you can contact me directly. My email's on all those websites. Please reach out to us. We love having these conversations and welcome new and diverse thinking into our program.
Well, thank you so much for today. This has been so fascinating, and I appreciate everybody that showed up today and also everybody that's watching the replay. This has been very informative, and without you guys, this conversation wouldn't exist. So thank you, John Mckeon, for joining us today. And until we meet again, leave the world a cleaner place than when you found it.
Bye-bye.